Dear Professor, oh yes, I can remove my mask. Yes, I'm far away from everyone there. So, dear Professor Jérôme Salomon, dear Mr. Bloch, dear everyone there in the room and dear everyone there online, it's a great pleasure for me to at last introduce you during a physical meeting and not only an online meeting, the EU-JAV, and to present what has been done. Today, most of the floor will be given to the scientists and the experts that have worked tirelessly and endlessly on their different areas regarding vaccination in the EU-JAV. And I just want to make a small introduction. Where does it come from and what was its purpose? We all know the context. Vaccination is a wonderful tool in public health and for the health of population. It can stop pandemics. It has done this in the past, and it is doing this again nowadays. It can prevent infectious disease, and it can prevent cancer associated to virus, for example, liver carcinoma or cervix carcinoma. It is a tool for everyone, from the newborn to the very elderly. For some diseases, there is still no vaccine. I think, of course, of HIV after decades of research. And for other, for example, COVID-19, the past 2 years have been a brilliant illustration of what a vaccine or a handful of vaccine can do at a global level and saving life every day. Yet, when we try to make more and more people vaccinated, when we try to improve the vaccine uptake globally, we are facing some issues. And the vaccine hesitancy, I don't mean only vaccine refusal, but more broadly, some hesitancy is growing globally, including in Europe. We are facing some vaccine shortages. And this impacts the opportunity for people to get vaccinated, but it also impacts the confidence of the public in the health system. We are all producing a lot of data regarding the vaccine uptake, regarding the vaccine coverage in our different countries. But yet, those data are not always easy to gather and to analyze at a continental level. We all have difference between our vaccine schedules from one country to another, and this may also impact maybe the confidence of people in the vaccine. And we do not function the same ways regarding the identification of vaccine research priority, of our research funding, and this also can be improved. When Europe faces a problem, one of the ways to address it is to make a joint action. And in the past, the European Union has launched a lot of joint action. For example, one on the health regulation and preparedness in the EU, one on tobacco control, one on the frailty associated with age in the elderly, one on chronic diseases, one on antimicrobial resistance and healthcare-associated infection, one on rare cancer, one on nutrition and physical activity. And there is it has been launched 3 years and a half ago, a joint action on vaccination. And this joint action has a leading purpose. We try to build concrete tools to improve vaccination coverage in Europe and strengthen national immunization program. It has been a very ambitious project, an ambitious consortium with 20 partners, 3 years and 8 months, a budget of nearly 6 million euros, and 5 major topics had been identified when designing it. The vaccine, not only confidence, but also complacency and convenience, all the hurdles that someone may meet when thinking about getting vaccinated. All our national digital immunization information systems, the prevention of shortages, the identification of the research priorities regarding vaccination, the communication, in particular toward youth, and the training, in particular of the healthcare professional. And seeing this map of all the countries involved in the EU-JAV, I can only think about what is happening in the East with the aggression from the Putin administration toward Ukraine. And I can only think of all the scientists, the experts, the physician, the healthcare professional, the stakeholders in Russia and mainly in Ukraine who are facing this event. As one can say, the war is never the solution, and we all need to seek a way to work globally in peace for the sake of the population. In other words, the main objectives and globally the framework of the EU-JAV was along those items. We want to increase public confidence. We want to increase healthcare professional skills. We want to improve the identification of research priorities. We want to improve vaccine research funding. We want to have a better interoperability of national digital systems of surveillance, for example. And we want to do all this in a spirit of collaboration at a supranational level, at a European level. We want to do this in a spirit of synergy between experts, policymakers, NGOs, and of course, every citizen. And we wanted to do something sustainable. We wanted something that will last after this joint action. And so these are the different areas that have been covered by the EU-JAV. If my instrument works. This is the EU-JAV of the structure of the EU-JAV. Some teams were dedicated to coordination, dissemination, evaluation, research for sustainability, and others were focused on more precise vaccine-related issues. One team was dedicated on immunization information systems to explore which systems were in place in the different countries in Europe, to use them to build an online platform to visualize the data regarding vaccine coverage, to explore the reminder systems in Europe to be sure that no one is missing an injection and jab. And another part of this team was also dedicated to identify how to launch cross-border vaccination. If the vaccine coverage, for example, identify a gap at a border, to what extent is it possible to launch a cross-border vaccination campaign in the 2 or the 3 concerned countries? One of the team was focused on supply and preparedness to review what has occurred in the past regarding vaccine shortage, to identify the mechanism to forecast the vaccine need and how to improve the anticipation of those needs and how to improve the stocks that we are doing. And to determine whether it was possible to have at a European level a gathering of all this data of anticipated needs, of stockpiling, and maybe to have an exchange possible between countries. And at the end, to obtain what was before COVID, something which appeared very exotic, but not anymore, to have a centralized procurement of vaccine at a supranational level. Another team was focused on a research prioritization, and they have validated a method to identify in a consensual way the research priorities to be funded in the near future. And this is something that can be done annually to identify annually where we have to put efficiently the funds. And these teams have also worked on how to have some joint action regarding the funding of research, the collaboration in the funding of research. Another team has worked on vaccine hesitancy. First, to collect, to gather all the actions that have been conducted in Europe regarding the vaccine hesitancy and how to address it and how to improve vaccine uptake in the population, to identify what works and what does not work, and to help preparing future efficient action in this field. And also part of this team has elaborated some tools to monitor the public confidence in vaccine by exploring the trends regarding vaccine confidence in the social media, including Twitter. Another mixed team was more focused on communication, and they have elaborated tools, so-called barometer, to measure, to evaluate the need in training of healthcare professionals, and they have elaborated a curriculum to address such need in training. They have launched 2 actions of communications toward youth. Another part of this team was dedicated to the sustainability of all the tools and the recommendation that the EU-JAV would produce. As an overview maybe of the results, we can see all these deliverables, all these tasks that have been achieved, and most of them are available online, and at the end, all of them will be available online, including those that will be delivered in the coming weeks. 3 platforms have been created. They will be described to you today. We have held general assemblies and info day. We have identified a lot of stakeholders. We have presented the project in different external meetings. We have created a vaccine network, gathering all those who have an interest in vaccination in Europe. We have launched 2 school competitions. We have launched a website where we received more than 3 million visits at this day, 1 Facebook page, 1 Twitter account, and some newsletter, and 1 again in preparation, and 1 more in preparation. Of course, it is not possible not to have a word on the COVID-19. I am speaking to you without mask, but I can see everyone there in the room with his mask or her mask. And when the EU-JAV was designed in 2017 or 18, there was no pandemic yet. And we were not focused on such pandemic. Then COVID-19 has occurred, and it has put a very important weight on everybody's life, and including the government, including the healthcare systems. And most of the people deeply involved in the JAV have to be deeply involved in the national response to their countries. It is not a surprise that experts in vaccination, were the most involved in the national response in the past 2 years. And due to this, some work have been delayed. They have been performed, but with some delay. And we have to add an extension of 6 months to the initial period of the EU-JAV. But on the other hand, as was saying Professor Salomon, we have the perception, that the feeling that COVID-19 has illustrated with an extraordinary impact how relevant were all the fields of the EU-JAV: the joint procurement, the stockpiling, the address of vaccine hesitancy, the training of healthcare professionals, the identification of research priorities, the interest of cross-border vaccination between 2 or 3 countries. All of this have been put forward due to, I can't say thanks to, but due to the COVID-19 pandemic. And even if COVID-19 was not in the grant agreement of the EU-JAV in 2018, now it appears everywhere in the deliverables and in the tools and in the recommendations that are being produced. Before leaving the floor to the different teams that have worked on those different topics, I want to thank all the EU-JAV partners in the 20 countries, all those people that in the recent years have dedicated some part and sometimes very important times of their lives to the project. And this has led to a success of the joint action. So thank you very much to all of you. And in addition, I would like to thank all the stakeholders that have participated with us in some tools and some deliverables. All the member states, as we're saying, the two speakers before me, they will have a key role in the coming months and years regarding the EU-JAV legacy. Everyone at DG Santé and ADEA, all the people that participated in what has been produced and studied, surveyed, the workshop, the meeting, and the assembly, and the French Ministry of Solidarity and Health, who is welcoming us today for this meeting and who have been a support during these years. So thank you to all of you, and let's begin the presentation of our results.